Good morning, everyone, and welcome to the fourth Indian edition of Elets Diagnostic Leadership Summit. Decoding the Futuristic Diagnostic Sector. The global pandemic has drastically altered the perception of the diagnostic sector, placing it on the center stage. As preventing testing, at home care, and diagnostic results forming the core of the decision making, the diagnostic sector is poised for incremental growth. With this at the core, Elets Technomedia and eHealth Magazine is organizing the fourth Diagnostic Leadership Summit, the DLS, on 22nd and 23rd of March 2022 through a virtual platform on the theme Decoding Futuristic Diagnostic Sector. The fourth edition is being organized after the successful execution of the first three editions of the Elets Diagnostic Leadership Summit, which witnessed 1,500 plus delegates, 120 plus speakers, and 30 thought provoking sessions and panel discussions. Diagnostic leaders will be sharing their views on rapid diagnostic kits market, pandemic inducing lab accreditation, future of digitization of supply chains, and many other relevant topics. More than 60 thought leaders from across the country and the globe share in their insights over the next 2 days and 11 invigorating sessions at the fourth Elits Diagnostic Leadership Summit. And I would now introduce the panelists for today. With me, I have my senior colleague and project head, Special Projects Elets Technomedia, Mr. KC Mishra. Welcome, sir.
Namaskar.
We have with me, I have with me Mr. Pankaj Johari, Director Medical NABL. Welcome, Dr. Johari. Then Mr. Atul Mohan Kochar, Chief Executive Officer NABH. Welcome, Mr. Kochar. Dr. Ravi Kaur, Principal Advisor, Spice Health, Spices Promoters Venue. Welcome, Dr. Kaur. Abhimanyu Bhosle, Chief Executive Officer, Crelio Health. Welcome, Mr. Bhosle. And Prasad Nikam, Supply Chain Product Manager, Crelio Health. Welcome, Mr. Nikam.
Thank you. Thank you.
I would now hand over the baton to Mr. KC Mishra to take over the session and moderate it. Thank you so much.
Thank you so much, Tarannum. It's really a pleasure to interact with all esteemed panelists here, all known figures from the world of diagnostics. This fourth edition of Elets Diagnostic Leadership Summit has a long way since the first edition was took place around 2 years back. And in the past 2 years, in fact, the entire world has undergone a tectonic shift. Upside down changes have been witnessed in the entire world because of the pandemic. And the pandemic has also thrown open the sheer importance of the role of technology in all spheres of life. And we all have been seeing how technology has been touching all the sectors of the economy, all the spheres of life. And in fact, around a decade back or so, technology was seen as a differentiator to different products and services from the competition. Post-pandemic, the technology has become one of the most surviving, or I would say it's to become existential that in case any organization, a product is not adopting technologization, then there is a real danger of it getting extinct. Global platform on the global sphere. And when I talk of the global leadership, then again, this has been only possible because of the R&D capabilities of India's health ecosystem, plus also the technology capabilities of India's health ecosystem. And this, the entire world has seen how successfully we have administered the vaccination program, how successfully we introduced, when the initial days of COVID, there were no labs, there were no testing facilities, and how overnight we quickly ramped up the scale, ramped up the operations, and quickly rose to the occasion and started out rolling mass testing for the COVID pandemic. And this is one of the very minor example which I'm quoting. There are tens of such examples of how the Diagnostic Leadership Summit has rose to the occasion, leveraging technology and also leveraging the R&D capabilities of the country. So here, it's really a pleasure to be having here experts from this sector here, Mr. Pankaj Johari, Director of Medical, NABL. I can see Dr. Atul Kochar, CEO of NABH. We have industry leaders, Prasad Nikam and Abhimanyu Bhosle from Cremio Healthcare. And finally, Dr. Bigor is there, Principal Advisor, Spice Health. Coming to you, Mr. Pankaj Johari, a quick introduction or a quick opening remarks on the topic, decoding the futuristic diagnostic sector. How have been the journey so far, and where do we see ourselves 5 years, 10 years down the line? Dr. Pankaj Johari.
Yeah, thank you very much, Mr. Krishna Mishra, and uh, a very good morning to all. Uh, I think this is a really good platform uh, where the leaders of the stakeholders, which are important in the medical diagnostic, they have come together, and I hope that next 2 days are going to the important, and we would learn and we would understand, all the stakeholder would learn that how the diagnostic trends are going to be going to be futuristic and helpful in the medical sectors. Also, equally, this I'm say I would fortunate, and it's the most appropriate also for NABL to be part of this. Would also like to take this opportunity first to convey the best wishes of our CEO, Mr. N. Venkateswaran, uh, for this events. For I think in the past, for the second and third summit, NABL has been the supporting partner, and this time Mr. Venkateswaran, due to the is preoccupied with his schedule, he is not attending this. But however, the best wishes and support from NABL is always there. Uh, See, in the last, I mean, uh, last 2 years, that has been the difficult time for the country and for the entire, world, where we have faced the various challenges due to the COVID-19 19 pandemic. And this is a salute to the medical communities, particularly, I mean, I would say everyone, the manufacturers of the medical devices, the suppliers, the doctors, the laboratory persons, the lab technicians, everyone who have come together, they stood up to the challenges of this pandemic, and they provided full resources and full support. While the developed country were looking for the resources, that time our country, and particularly the domestic manufacturers, suppliers, and especially our doctors and the lab persons, they really come forward and they joined hand at how to counter the challenge of this pandemic. And I would say the challenges itself, they have set the tune of this summit itself, because this one thing become very clear to everyone, that diagnostic is going to be the uh, I mean, it has been but now it's going to be the most important stage of the medical fields, where we need the more accurate, more precise, and such diagnostic methods, such diagnostic technologies, which can bring the diagnostic closer to the patients. So this important thing, and this type of uh, learnings from the pandemic, they, I think, motivated the medical technocrats and engineers and the doctors also, everyone, to find the ways and means that how the futuristic technologies they can be developed, and how they can enter into the diagnostic labs, and how these can help the patient in particular. So this has been the very important thing, and I would congratulate the host to choose such an timely and very appropriate theme of these events. See, if I, what Dr. Mr. Krishna Mishra was saying, if I would go for that, you would see that a lot of technologies are now coming to the diagnostic sectors. We are going to have the robotics, AI-driven tools, technology-driven tools. So many good things now we are going to see in the benches of the diagnostic labs. Where the NABL and how the NABL see this. We see this as a kind of developments where they are array of the heterogeneous technologies entering into the labs. And when the array of heterogeneous technologies they are entering into the labs. We can see and we can anticipate a lot of procedural delays and the lapses and the errors, etc., which can be there. So, though we can be sure of the more reliable and more accurate test results from the machines, but overall in a lab where the system is dependent on the persons also, the environment also, everything. So there is a more need for the quality management system. So lab would need a more robust quality management system, and there would be more requirement of the of accreditations. And ISO 15189 comes into the picture, more stringently. So I would say, and I would suggest that all these stakeholders of the lab, they should emphasize more upon the quality principles, the quality practices. And these quality practices mostly come from the ISO 15189 in the labs. Uh, so, Mr. Banti, NABL is trying to collect a new quality. It's not only the technical sectors. So, I would, at this stage, I would open the these arguments and this discussion open for all. Uh, that how this holistically we can cover the quality of the medical sector, which includes not only the labs, this includes the supply chain, this includes the manufacture of the medical devices. So everything, how it can be holistically covered under accreditations, or the qualities, and how it can be maintained. NABL has already introduced medical imagings, and we are thinking about the POCT, diagnostic radiology, quality assurance testing. We have introduced the medical entry-level programs also. What I mean to suggest that NABL is already thinking of holistic accreditation. Now, when the futuristic trends will come, and they will enter with the new technologies. So, how we need to incorporate into a quality management system of the laboratory, that has to be seen. And for that, NABL will always strive and will always assure that from NABL side that we would support all the endeavors and efforts of the medical labs to come in large numbers for the accreditation and for the quality things. So with this, I would thanks the host,
Thank
and I
you.
would hand over the mic to Mr. Krishna Mishra to other speakers also.
Thank you, Pankaj. Thank you. I'll, of course, come back to you a couple of questions. Before that, am I audible? There is some fluctuation at my end.
You can.
Am I audible?
Yes, please. You are.
Yes, yes.
Pankaj, I have some questions for you. Of course, I'll come back to you. Before coming back to you, let us quickly hear from Atul Mohan Kochar also his opening remarks on the topic decoding the futuristic diagnostic sector.
Thank you, Mr. Krishna. Thank you, Mr. Pankaj, Dr. Ravi, Mr. Abhimanyu, Mr. Prasad. And at the outset, I must also compliment and congratulate Elets Technomedia and the team Elets for organizing this in the fourth session. I think the right kind of discussions are happening, the right kind of noise is being made, and amidst the pandemic lies the wonderful opportunity to improve, introspect, and deliver. So I think it's a very thematic topic what you have really brought forward. Decoding futuristic trend. I totally concur with Mr. Pankaj when he said that this has been a wonderful learning experience. Diagnostics has always been the backbone of any medical decision making. Only more so, we've learned to realize the absolute importance of quality management systems in real time. I mean, it was always there, but now the public is also aware about the timeliness of the entire thing. And we also realize that we need to scale up at such short notices. And the only way we can do it is by incorporating technology. And we also realize that we cannot get away by creating islands of excellence. We cannot have 1,200 or 1,500 or 2,000 labs. We have to develop quality and take quality to the last man in the line. By a very guess estimate, there are more than 6 lakh labs. I mean, small shops doing testing in remote corners of our big and wide country. Till we rate the quality, till we have basic tenets of quality in place, we are not going to make a real tangible difference. So ultimately, we have to have this concept of herd quality. We must take quality to the grassroots, and bridge the gaps by incorporating technology, AI, ML, everything. So India has always shown that we can do wonders if we put our heads together. We have always been at the forefront of technology in the world. We have leapfrogged so many other countries uh, by demonstrating our effectiveness of handling vaccines or by Aadhaar card. So every system is in place. Now we must start transforming. Actually, we must do introspection, and all these get-togethers, these wonderful thought leaders you're bringing together, these manthans you are conducting, Elets team. I think it's a wonderful initiative. And NABL, Quality Council of India, at the forefront of it, and all these thought leaders like Dr. Ravi and from the industry, Crilio Health, and so many others planned over the next 2 days. I must compliment and congratulate you again, and I think it's a wonderful gesture. And thank you for this opportunity for us to be a part of this inaugural session and this very thought-provoking deliberations, because it's a huge learning experience and motivation for all of us also to listen to the industry, tweak out the unnecessary steps in case there are in our processes, and we must. I'm very optimistic about the way it is unfolding for the diagnostic industry, and thank you for making us a small part of it. Thank you.
Thank you, Dr. Atul Kochar. Very rightly said that the need of the hour is not to produce islands of excellence. Rather, we have to scale up each and every process in the entire chain and take this quality to the last man on the queue so that the entire country is benefited rather than the islands of centers being pocketed in certain pockets of the country. So how do we scale up and how do we actually leverage technology? We have been able to leverage technology so effectively so far, but as you rightly mentioned, now the time has come for the real-time transformation of the sector. So how do we take it that way, and what are the current challenges, what are the opportunities in the sector? I will come back on that point also. But before that, let me invite Dr. Ravi Kaur, Principal Advisor, Spice Health, for his opening comments. Dr. Ravi.
Good morning, everybody. It's my pleasure to be here on this fourth Elets Diagnostic Leadership Summit, and I'd like to probably, thank the organizers, Mr. Mishra and the team, Elets team, and my pleasure to share this forum with Dr. Atul, Pankaj, the younger, the Abhimanyu, and Prashad. It's been I think, very, very, I think you can say last 1 year probably I've seen the three of the summits, very well organized, well thought of, and well planned. The summits where we're covering a lot of the, in fact, whatever is there in the diagnostics probably you're trying to decode, and that's exactly what we're doing. Today the topic is the decoding futuristic diagnostic sector, and the pathology is basically nothing but basically decodes what has really happened inside and how does it come out of the diagnosis. I'll probably say that today, in fact, as we move around, probably we have the two aspects already covered here. We have the Pankaj and Dr. Atul from the quality, and we have Abhimanyu and Prashad coming out from the IT segment. I think these two are going to be the important factors as we go forward and decode the diagnostic sector. They're going to drive, to my mind, more or less future. It's going to be like what we call it as probably a Google map, pathology like a Google map. Now we have started at a one place, and will be like, direction will be given by the pathology, and making the clinicians probably giving the best directions, and even the patient and the consumer to know best where to reach and what is going to be health destination for them to be, and the right health destination. I think we have people from quality. We'll be hearing from, I think, IT. I'll probably talk from technical part of it, couple of things before we enter the summit, because when it comes to living a long and healthy life, we have to know what causes and can stop disease, and getting the right diagnosis is a key aspect of healthcare. It provides an explanation of patient's health problem and informs subsequent healthcare decision. That's where the pathology stands. Pathology is the study of disease, how they form, spread, and where they originate. But the diagnostic process is very complex. Collaborative activities that involve the clinical reasoning and information gathering to determine a patient's health problem. Now, improving the diagnostic process is not only possible, but also represent, I think, Monas and all of us, a moral, professional, public health imperative. We're supposed to be doing continuously, taking to the next level. Just as the I think the diagnostic process is a collaborative activity, improving diagnosis will require collaboration and widespread commitment to change among healthcare professionals, healthcare organizations, patients, their families, researchers, and policymakers. I think this is going to be the very concentrated and the collaborative the drive, and that's what we have seen in the COVID time. I think all, whether it's a policymaker, researchers, scientists, devices, into technology, everybody came together, scientists, everybody, because the great job done by the quality people, NABL, and they've done a wonderful job probably by getting the labs, getting the best quality. Similarly, the NABH keeping hospital the best of the quality and probably keeping the doctors and these providers and these patients safe from various other elements and getting the best quality outcome. So I think this is going to be definitely a very collaborative effect. Now, pathology today is, I'll see, is the industry is very large. We don't know, really speaking, how many number of labs, something 1.5 lakh, 2 lakh, 3 lakh, really don't know, because there's no nothing listing out pathology labs today as of now in the country. We just probably the guess. And I think it's more, my mind is becoming like a barber shop. Every corner you find a pathology, we really don't know who's the right barber out there, because I think that's where the future is. I think we need to at least have some kind of a the base benchmark diagnostic star over there. This is at least some practices we follow it. Nothing accreditation, but at least the mandatory participation in EQUAS. I think that's going to probably lead us to the future, and that could be one of the norms probably getting before you start even a pathology lab. Now, in recent time, we have witnessed some of the major outbreaks of various diseases in human beings, and ultimate conclusion what we draw is that traditional diagnostic tools and techniques are not up to the mark at all, particularly for a faster, final, and rapid diagnosis. That's what we saw when we just landed into the COVID. Because we were really know what is going to be happening. The dictum was test, 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 testing for diagnosis, testing to track, testing to treat, and testing afterwards to predict what is going to happen the long term. I think everything was test, 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 and we were probably not ready at that point of time. But today, we definitely have the right. We understand the need, the future ready to understand our health issues. Now, pathology, when it comes to the technical part, I'm being a pathologist, probably I'll say there's multiple branches today. We have general pathology, anatomical pathology, clinical pathology, chemical pathology, genetics, hematology, immunology, microbiology, and much, much more. And even now, it's, I think, helping out the research on medical drugs that might help prevent or cure a disease. I think this is an area of pathology. But there is, I feel, before I like to say the couple of things more, that there is a need for dynamic techniques with a wide spectrum application, which can probably cover early diagnosis and characterization. That's the technology we will be looking into it from the futuristic point of view. Genomics is right; it's going to be there. We need to work on the DNA, RNA based assays. Early prediction of anything for outbreaks or disease or anything, that's a predictive kind of a pathology testing is going to be. Now people are expecting that. The drugs, novel drug development, I think pathologists have to be part on how do they that probably the bioinformatics, the companion diagnosis, whether it's AI or machine learning or putting together various documents, that's going to help us with personalized medicine, what we are arriving today. Pathologists have to play a very, very important role going forward. And this they are doing, but I think future will be much more on that. Then the customer expectation probably, here is the customers become global and they are probably the aspirations are too high. I think we need to fulfill that part. We not only pre-analytical, analytical part of the pathology sample, but I think one segment, the customer wants everything right on the doorstep. They want the best of turnaround time at the most affordable cost, quality driven, and probably as rapid as reporting tests and screening as fast as possible. And they also want some kind of clinicians also want us to give us some kind of a solution, because I think this is where I think the future is going to be much more. Then everybody looking for transparency and efficiency, and then the low cost solution. I think that's another area. I think more research, more development would happen, and I think technology would help us to optimize our cost. And the lastly, very important, that you have to keep up with the innovations, because the technology is developing very fast. What is there today, maybe it's just we work on today. Probably by the time we start producing results, it become outdated. Some new technology has come. So unless you do a continuous spectrum of work on pathology, I think this is going to be the challenge. So we future lies to take care of all these aspects together and prepare ourselves. Now we are into an era of the emergence of new diseases. I think that's there, and a re-emergence of infection. That's something what we probably thought. That we have seen in the last probably 2 decades. We have seen many infectious diseases which were actually late in there come up again. Like we have, and many new infections have come up again, like swine flu, COVID, the Ebola, avian bird flu, Zika. These are all, I think, many more probably going to come because that's because of the ecological imbalances. What's happening? We probably have to be ready for that. The more non-communicable diseases, because the lifespan has increased, more number of people are going to be, lifespan is more from 60 to 80 years of age. It's gone up. So I think non-communicable monitoring disease, diabetes, lifestyle disorders, and that's something who's probably be ready. Cancers is another area which are growing. We need to preparing for screening testing for cancer. What to talk about final diagnosis, and of course the end diagnosis is very important equally. Wellness aspiration, lifestyle, because people are now want to be, they're perfectly fine, they still want to be well, they want to know what's happening inside them. So there's a new industry which is probably coming out, is the wellness testing and the sickness testing. I think that you have seen this markup. A lot of newer players are focusing only on the wellness, and this is, and that one affordable wellness at the doorstep. Probably all pathology had to provide that. Biomarkers for early information, automation is another area probably again because the cost has to be given. Today it may be investment. I think tomorrow that's going to give us a result. And the integration probably, IT has to do a major role here, integrating from pre-analytical to analytical to post-analytical. All this is going to be a very important part. So I think with this, I'll probably say, we have a lot more right from molecular to digital pathology, which is going to be a AI-driven, a perfect storm. And then probably we have a molecular microbiology. There's some NGS. We're talking about, you can say, the new service delivery models. And of course, quality goes by default. It has to be integral part of everything. So I think this is what I see the future of pathologies. I think we all have to be ready with this. Unless you are ready with that, I think we, as a pathologist, will lag behind. We need to work on it, and I'm sure many people, leaders out there, they have already started working, and probably they're already working and they're delivered also, and they're going to deliver. But I think still 80% of pathology labs had to work and be prepared for the future. Thank you so much.
Thank you, Dr. Ravi Gaur. Now I'd like to invite Abhimanyu Bhosle, CEO of Credio Health, for his quick opening comment.
Yeah.
Decoding futuristic trends.
Yes.
Diagnostic industry.
Thank you, Mr. Mishra, and I'm actually really happy to share the stage with Mr. Pankaj, Dr. Atul, Dr. Gaur, and so we as a company, we've always actually believed in building products that ultimately improve lives of diagnosticians, labs on a day-to-day basis. And when Elets actually came up with this event to have discussions on the futuristic diagnostic industry and the opportunities in this space going in the future, we were really excited to partner. So obviously, I think one of the main one of the main impact areas that diagnostic has had is COVID, and COVID has played a big turning point in everyone's life in the last couple of years. And doctors like Mr. Gaur actually have stood ground, like executed the real hard things that we talk about. And I think really commendable to the overall diagnostic sector that how it has actually caught up to the full demand of country as large as India, and under quality expectations of NABL in the COVID times, and also beyond that as we go forward. So we've seen that technology has played like a good companion in growing quality at scale, and also improving turnaround times across the business of labs. And I think it even more plays like further vital roles, like a couple of them that Dr. Gaur actually talked about. And like personalizing healthcare is actually one of the main areas that ultimately technology can do at scale, which is very difficult to do today on ground. But on the other hand, it also has many contributions yet to be seen in terms of optimizations of supply chain, optimizations of lab processes, quality control, and home collection processes, online booking experiences, and multiple other areas that diagnostic labs deal with, like patients, providers, or internally in the lab. So we've seen that many of these processes are like documentable, and of course a large part of ISO 15189 has actually done that in extremely structured manner, and really replicating that for every lab, and scaling that so that more and more people are able to actually do this, and more easily are able to understand these standards and scale these standards, become extremely vital as the business and the diagnostic industry grows overall. Not to mention, of course, this is each test and each report, each part of healthcare experience is very personal to all of us. So that also adds a lot of emotional factor in the entire healthcare experience of patient journeys. And many a times in scaling up these processes, the emotional or the patient connect gets missed out. And the main differentiation that technology can add going in the future is personalizing that patient experience for all of us, and really making sure that the lab or the hospital is able to actually connect and personalize their healthcare services to those patients. Many of such examples that we saw with examples of smart reports and like personalized packages that Dr. Gore generally shares about, and many such pricing personalizations that we've seen, which can really help people pick the right package, pick the right service, have now they seem to be more doable today, and we see that over time they would be a reality, especially in just a coming up couple of months. So yeah, I think we are committed towards contributing for technology innovation and adoption in the diagnostic sector, and we thank Elets for setting the stage for enabling this discussion, and we are really excited for the discussions today and tomorrow. So thank you, Mr. Ajay. And,
Thank you, Abhimanyu-ji. Coming back to Mr. Pankaj Johari, Pankaj-ji, you were mentioning about integrating the various stakeholders in the laboratory ecosystem, whether the technicians themselves or the debottlenecking the supply chains or the manufacturers. You were mentioning about to integrate all these and other challenges. So, what are the other challenges which you are foreseeing in this sector, and what are the opportunities, and where do we go from here, Mr. Pankaj Johari?
Yeah. Actually, why I was saying this, right now the time has come where anything cannot. I hope I am.
My interest fluctuating.
yes, we can hear you, Mr. Pankaj.
Okay. So actually,
Yeah,
the
Mr. Johari,
time
please
has
go
come
ahead.
where nothing can be seen in isolation. This is the point, because everything has to be seen in an integrated way, in a holistic way. If you see in a lab, in the laboratory, the equipments are being supplied by some supplier. Supplier is getting some instrument, that medical device from some manufacturers. Now, my point is, we need to plug the loops, and we need to ensure that the quality start from the first point from where the product is getting produced. And so it must be subjected to the strict quality control test in the laboratory of the manufacturer first. And during the entire logistics and supply chain management, the integrity of the product is to be ensured. that is to be that specification. There is no disturbance also to the specifications, that has to be ensured. So everything, right from the manufacturer's premises to the destination, I would say the lab, the whole chain and every stages in that supply chain, it need to be ensured that everything is quality driven, and the mindset of the people who are responsible, who are honor, and who have that mandate to deliver the quality products in the whole chain, they that mindset should be the quality conscious. So that is the approach of NABL. And I would give you the example of this, because now this theme of this event is futuristic, we are decoding futuristic areas. So now this AI driven and that machine learning and big data and all this much automation, this all is going to have the most crucial and very important roles in the labs. Everything is software driven. The procedure is programmed. There is a coding for everything. So NABL, when thought about this, when everything is equipment dependent, almost, then software validation is a key area, because manufacturer supplying that this is software, a software driven program, there is a program, there is a coding, but what is the testimony and where is the assurance that this is validated? And if it is validated, then it is validated by those agencies who know how to validate it, and during the validation they have ensured and they have followed the proper procedures. So what we mean to say, that every stage in the supply chain management of the diagnostic sector, it should be quality conscious, should be driven by the principle that ultimately lead to the benefit of the people at large. That was my point. And I would, in fact, ask the medical labs to ensure their vendors, their suppliers, that they also have a well-led quality management system in their premises, in their systems, everywhere. So this is the duty of the medical diagnostic labs also, their owners, the doctors, the technocrats also. That was my point. And for that reason, NABL started the accreditation program for the software and IT testing also, because those who are validating the software, they also must have some kind of quality principles in their labs. NABL started a diagnostic radiology quality assurance testing programs, where the X-ray machines is there, or CT machines is there, or other X-ray emitting machines are there. The test reports, which is produced by the inspecting agencies, the certifying agency, these agencies should also have quality. So we are trying to collect the huge holes, and that is my request to all the diagnostic lab and all the leaders of this, all the stakeholders in this medical sector, to kindly assure that they themselves are following the quality, and they are encouraging others also to follow the quality. Thank you.
Thank you, Pankajji. Prasad Nikam is there with us, supply chain product manager with Trilio Health. So, Pankaj Nikam, would you like to add what Mr. Pankaj Johari just mentioned about
Yeah, sure.
debottlenecking the supply chain, or you
Yeah,
can share your own example, your own experiences, what your
sure.
challenges
Yeah.
in the supply chain, and how streamline
Yes.
them.
Yes. So first, thank you for inviting me here with all the esteemed guests, Mr. Pankaj, Dr. Atul, Dr. Ravi. And if you see the discussion that we have started with Mr. Pankaj and Dr. Atul has mentioned about AI, ML, and all those aspects, right? So there are 2-3 parts of supply chain that needs to be addressed in order to make sure that the quality is there, and at the same time we are managing supply chain at a very optimized level. So the first part is a collaboration. As Mr. Pankaj explained, that there are vendors, there are manufacturers, there are different players, the diagnostic players, there are IT softwares. So there are multiple stakeholders in this system which needs to collaborate to make sure that the great best service is provided to the patients. At the same time, the quality is maintained, and including all these things, we have to make sure that the cost and optimization is there. Now you can see that the collaboration across different players in this is extremely difficult, because you have numbers of vendors, you have numbers of diagnostic labs, numbers of patients, numbers of manufacturers. Now, here the most important part that can play a role to make sure that the collaboration happens is software, and which is a digitization. So, the first step in order to make sure that the collaboration works out across the different stakeholders in the system is a digitization, and I think that's a crucial step and first step to move forward. Also, as Mr. Pankaj and Dr. Atul, Dr. Ravi, you can see that these are from the policy making and from the medical industry. They are talking about AI, ML, and I am really glad that people in all the stakeholder understand the importance of predictive analytics and AI and ML. And again, if you think about these things, like if you really want to go to that stage where we have a predictive analytics in the place and AI ML, which is transforming the industry altogether, and which everybody believes that is inevitable. It's a matter of few years that, or maybe few decades, that this is going to happen. Again, on this part, the first step is going to be digitization, because if you don't have the data and information in place, it's a like machines or AI or ML algorithms cannot do anything about it. So I think the first step towards, as Dr. Atul mentioned, that we need to start the transformation. And I think the first step when it comes to transformation of the whole industry, whether it's supply management, whether it is patient communication, patient experience, or it may be optimization of the whole chain, is going to be the digitization. And I think going forward next 4 to 6 years, that is going to be the most important aspect of any industry, I would say, but especially diagnostic industry, considering the amount of information and data and the stakeholders that are involved in this industry. So I think uh, this is the first step towards that future that we are looking for.
Thank you, Prasadji. Going back to Dr. Atul Kochar, who was mentioning about he used a very nice term, islands of excellence, which we are now having, and the need of the hour is to scale up this thing. My question to Dr. Atul Kochar is that it's a very strange paradox. We have got all the right ingredients in place. We have got no dearth of skilled manpower in the country. We have got no dearth of capital also. We are tech savvy as well. We have having tech prowess with us. Plus, also there is no dearth of demand as well. So, what is really holding us back from scaling up? What typical challenges do you foresee in taking these islands of excellence to throughout the length and breadth of the country? Is there something which is lacking on the part of regulation, or is there something else? Dr. Atul Kochar.
Yeah. Thank you, Mr. Krishna. I think this has been a good discussion. So, with minor correction, actually, so there is a dearth of manpower, trained manpower. That is one. But you're very
Skilled
correct.
manpower.
Yeah. There's though absolutely no dearth of capital or skill sets or the demand, rather that. But policymakers have taken note now. See, the entire low hanging fruit of the entire pandemic thing is that all these discussions are now happening, and everything is now being discussed and thrashed out, and additional budget. So we were spending only about less than 1% of our GDP. So now a government has committed uh, officially to raise these stakes very significantly. They've committed to 3% now, and they'll be going on to nearly 20%. So that roadmap is very clear, right? So what we were lacking, or rather, everything is in place. But as I think somebody mentioned, Dr. Ravi mentioned that there's absolutely no requirement to open a pathology or a diagnostic setup. I mean, if you open a sweet shop, there may be 20 licenses which are required currently, but anybody, any Tom, Dick, or Harry can open a pathology lab, and we are not aware whether these are, I mean, they're worse than a barber shop, for example. So how to raise that standard? This may be a challenge, but now policymakers have taken note. Technology has always been there. We have proven our mettle at various opportunities, like we mentioned. So India has been at the forefront of technology, handling the pandemic, the vaccine part, and our honorable Prime Minister on 27th of September also uh, uh, officially released the ABDM, Ayushman Bharat Digital Mission. So as Mr. Prasad Nikam just mentioned, the future trend, the most important trend, which we can touch and feel, is the digital health. And diagnostics is very well poised to be the pioneer in that, actually. Because this generates data. There's already, automation there. There's already software like Exacta or other things which feed the results automatically. So these are closed systems which are already existing. They generate from the entry of a blood sample, for example. You get a closed system report, which is already, you can see real time. So already such apps are there, already such processes have been defined. So diagnostic sector is very well poised to take the full advantage of ABDM framework, which is the fire. The FHIR is there, so everybody's talking about it. And I must there's active work going on as we speak. The sandbox is already in place. There are 1,000 odd apps which are already there, and STQC is certifying. NABL already has a software certifying mechanism. So variables are there. So these trends are not distant future; they are already here. So this is happening. As far as the issue of trained manpower is concerned, we also need to bring in telepathology. So that is one where some legality issues, some policy matters have to be framed up, frozen up. But that is the only way we can bridge the gap between the provider and the providee. Like telemedicine has done wonders. Uh, on the e-Sanjeevani portal, more than there are 2 or 3 crores of consultations have happened across the length and breadth of the country. These are free consultations, and there are nearly 1,000 apps which are now providing evidence-based telemedicine with all tenets of quality in place. So because they're the basic framework. But now with the Personal Data Protection Act being in the weighings, that also is a reality that we have to really firm up these policy. Just to take an example, when the pandemic first struck 2 years back, we were caught. I mean, caught waiting, actually. So we were frozen for a maybe good 15 days. We had to bring out our policy. Then we started drafting the virtual policies, not one or two, but 245 virtual assessments policy we drafted, which were complemented word by. I'm speaking for NABH now. And we carried out till date more than 4,000 assessments on these virtual platforms, which are benchmarked to the best in the world. So that was the innovation, that was the transformation, and we need more such ideas. We need more such generation, more such trends to bring up the exact potential of the diagnostics. There's been so much said about the predictable analysis. So that is a wonderful thing. A personalized medicine, the personalized affordable wellness. So all these are wonderful ideas which need to be taken forward. So I think, and the next generation of trends, obviously, everybody has spoken about it, that genetic, molecular, uh, point of care testing, home based testing. So these are all wonderful trends which are there. But ultimately, we are as good as the last man in the line, the weakest chain in the link. So we have to strengthen that chain, and only that can happen when we bring in some kind of maybe a basic MSR, we call it, minimum standard requirements for a lab, maybe a registration to start with at a policy level, so that at least on tap of a button we can see how many labs are operational in our country. So that number has to be concretized. So maybe all states need to come together. We are a big country, and we are not only one country. You can say we are 36 countries, actually. So every state of ours is equivalent to a country in a Europe or parts of different parts of the world. So these all have to come together. So policymakers have to work further. ABDM is a wonderful thing which will shape our future in the near thing. The portability of results, the pushing of results, as we see in US, UK, and other countries, standardization in technology sector. So all these are opportunities to look forward to. So personally, I'm very, very optimistic. There are challenges, but overall, the scenario is wonderfully optimistic, and things have already started moving. NHA has already started certifying labs for that, and that is going to be a game changer. See, 50 crores of our population, I mean, nearly 40% of our big population is covered under the Ayushman Bharat Yojanas, right? So that is a wonderful thing. And the ABDM framework is going to be very holistic and start enrolling everything and start the mission of taking quality to the last man in the line. So this is the way I see it. Thank you.
Thank you, Dr. Atul. Dr. Ravi Kaur, would you like to add what Dr. Atul just mentioned?
I think very comprehensively covered discussion we had here. I think I will probably just emphasize repeat on that is first the collaboration. I think unless you integrate all of them together, this is not going to work. I think it is very important to have end-to-end integration, and that integration today we have seen what we did in COVID. Was done. We had end-to-end integration right from the researchers to policy makers to accreditation bodies to reporting on the in the COVID portal. Then everything was there, and we had and prediction everything, and from there the vaccine. Today we have the everybody list COVID portal, what test was done, containment policies, everything, and because of that, device makers, kit manufacturers, reagent manufacturers, everything it was so transparent and in front. Results are there. We were able to contain. I think that's exactly had this been that I've been saying done for say approaching cancer or tuberculosis for that matter in the past. I think we would have got it up to TB long back, but it is still not happening. I think whatever we have created that infrastructure and system during the COVID, I think we need to take that forward an example, and this is going to be produced result. And one important something too, I think Dr. Atul mentioned a very another important good talk about herd quality. That's something kind of herd immunity we're talking about. I think why not our herd quality? Because quality has to go in the mindset of people. And for that, because I think a huge awareness, which has been done again in COVID. People were asking, are you ICMR enable approved lab? Let's get a COVID test done. I think same thing now people have to say, no, lab need to have some kind of accreditation, EQUAS participation, which could be transparently, just click on the button, you say this lab is there and what is the EQUAS quality control graphics. If you can see that, your job is done. There's a basic thing which probably should be made mandatory. And shortage of pathologies in skill is another area. Regulations of telepathology, I think a lot of resistance happening here and there because we need to have a decision on that. But if the mindset change for that, if the NABL or NABH, some kind of a courses or short courses, or could be part of the undergraduate and postgraduate teaching programs, to my mind, at that level, when somebody is being taught, you have a chapter or two chapter and a question is asked every year, the question paper about the quality and what is accreditation policy system. I think this will change the mindset, because whatever you're taught in your school, you at least remains in the back of your mind and you tend to follow that. I think this is something like to add. So there's a lot happening. I think I'm excited. I've been part of the journey for long. I've seen basic conventional to full automation, integration happening by the IT, and great work done by quality makers. I think the concept and the journey should go on, and I'm very hopeful. I think we'll all together can do the needful. Thank you.
True. There is a lot happening and much more to happen. A very interesting topic here, decoding the future trends in the diagnostic leadership. It's such an interesting discussion with all the experts here that I will take up this point with our health vertical that 1 hour is too less for a meaningful discussion. I'd like to extend this session by 10 minutes. Before we actually conclude, I will invite Mr. Prasad Nikam, the supply chain product manager in Radio Health. He has got a short presentation to make. Prasad ji, over to you.
Sure, thank you. So we have at Cradio Health multiple products which solve the diagnostic industry's problems, and one of the key problems that we see is the inventory management and supply chain part of the things. So we have a product called inventory management software, which involves inventory management, which involves the cost optimization, and also we are going to add when it comes to NABL and quality, the supply and the stock is extremely important part to make sure that the quality is delivered to the patient, right? So even the industry, we believe that it is not convinced that much that inventory is the most important, one of the most important parts. Even when it comes to quality also, we have thought that we have to make sure that there's a product that exists in market which can solve these problems. So we have a 12 minutes video of the product demo. Let me share my screen and I'll just play the video, and let me know if you are able to see my screen.
Yes, we can.
Yeah. So welcome to Brilliant Inventory Management Software. Around 30% of variable cost in diagnostic business is related to inventory. Considering the importance of inventory management in diagnostic business, we have built the product keeping productivity. Are you able to hear? I hope that it's
Yes,
audible.
we can see.
Yeah. Are you able to hear the voice in the video?
Audio, if you can increase, it will help.
Yeah, audio is a bit low. Okay.
Is there no audio, or is there some issue in audio?
We're not able to hear to the audio.
Sorry. I was on mute. On file kits available. So there are different kind of products that are there with their total stock that is available in your store. Along with this, we provide lot expired alert. So you can see that all the lots of HIV kit have been expired. Also, we provide near expiry 7 days, near expiry 14 days, and near expiry 21 days tagging, so that your team understands which are stock that are going to expire, so that they can take decisive action. Along with that, you can see this in alert quantity here. If the stock goes below this alert quantity, then it will be marked in red, as you can see here, and as the stock has been below alert level quantity, and you should place order for these particular products. Now, in addition to this, what store manager has to do is that there are different places, departments, different locations. For example, if you are doing centralized procurement, then there are different location labs. You have B2B partners. There are different sections that places order to the store, and store manager has to transfer the stock to the respective places. So for example, say, as you can see that this is department orders. There are, for example, say pathology department. These are order placed from pathology department. We can transfer the orders, select the order detail, and then you can see that these are the lot that are available. You can put the transfer quantity and transfer the stock to the respective department. Similarly, if you are planning to do centralized procurement, you can manage centralized procurement in our software. This is, for example, this is a Mumbai location, and you can see that from Pune location, you have that 15 orders. You click on this and you'll get to know that all order details with the transfer status and the receive status. So for example, you select order number 67, you select this. Here you can see that albumin, the order quantity is 2, transfer quantity is 2, and details of transfer. Similarly, if you have B2B partners or collection centers for which you manage the stock, they can raise the request in similar manner, the orders to the main store, and main store can transfer the stock. So this is the stock management at the store level. Now, in addition to this, what we have provided is we have provided a dashboard for store manager so that their day-to-day activities becomes very easy. Here you can say that there are 4 sections. The one section you can see that the urgent actions. For example, say there are 5 products which are going to get expired in the next 21 days, and 82,802 rupees worth of stock is at risk. Similarly, how much current stock is available at store in terms of value at department levels, how many orders needs to be processed from different locations, how much payments are pending. There are 51 POs for which around 5 lakh rupees worth of payment is pending, how much wastage has happened, etc. So what dashboard does is it provides all the information to make your team a decisive team so that they can take actions with an information that is relevant to that action. Now, what we'll do is that we'll go to the consumption part, as we have seen stock management, order management, and dashboard to make sure that the day-to-day activities for store managers are easy to make. We'll go to the consumption part. Now, as you have multiple SKUs, there's around 4,000, 5,000 SKUs, consuming stock on day-to-day basis becomes a very tedious process. So that's why we have provided automated stock consumption feature. So there are 2 types of consumption which can be automated. One is sample stock related consumption and taste processing related consumption. So what we have done in the system is that we have provided, there are different types of some sample types in the system. And for example, say there's a serum type. What you can do is that you can map different inventories to this particular sample type. And whenever this particular sample is received in the system, then this stock with this quantity will get consumed from the respective departments. Similarly, for stock test mapping, we have provided, for example, say toxoplasma IgG antibody. This is a stock that has been mapped against this one particular test. When this particular test gets done in the system and submitted successfully, the stock related to this test with this quantity will get deducted from the system automatically. In addition to that, we have provided QC mapping. So what you can do here is that you can club multiple inventories which are related to QC and create the group of inventories with a title. Whenever you run particular QC with that particular grouping, you just have to click on the run. So for example, this is a Siemens device QC. You click on this. These are inventory items mapped with these quantities. You can map more inventories if you want to map more inventories. And whenever you run the QC in the system, you can click on the run and complete the stock. So the idea here is that there are two advantages of this. One is that there are 5-10 QCs you run in the system, and it becomes tedious to consume 80-100 different types of stocks in the system manually. It helps you to make sure that the consumption is very easily done with one click. In addition to this, when you want to see the consumption pattern, which will come in some part, you will be able to get the bifurcation of the stock consumption across different types of consumption, of which one of them will be QC consumption. Now, this is a consumption. You can see that not only stock consumptions for QC and for test and for samples have provided. Now, where do you see the consumption in real-time basis? It's very important that you track consumption on day-to-day basis or maybe weekly basis in the system. So this is a consumption analytics. This is a real-time consumption analytics. You can see that in this lab for last 30 days, around 22 lakh rupees worth of stock was consumed. Now you can see that department-wise, let's say I want to understand pathology, how much was consumption. You can say 49,625 rupees worth of stock was consumed. In addition to this, we provide a type of consumption. So you can see in pathology department, around 17,411 rupees worth of stock was consumed manually. Around 0 rupees was consumed against automated stock consumption. Audit adjustments were done a lot of times. You can see that 32,000 rupees worth of stock was adjusted in the system, and QC consumed around 198 rupees of the stock, and there was no disposal done in last 30 days. Again, you want to know on this particular rate what happened inventory wise. You can select one particular inventory and you can understand different type of consumption at inventory level also. So what it does is that it provides a real-time consumption analytics along with the type of consumption, so that you can decide, for example, say here, you can see that a lot of consumption happened through audit adjustments, and you need to optimize that. There's some problem in the system where every audit is consuming a lot of stock, and which is not a correct way of managing the stock. Now, this isn't consumption analytics, but how would you know that at the end, inventory management is about capital allocation? A lot of your capital is stuck in terms of inventory. So how do you do that analysis? So there's a stock analysis feature. Let's say for last 30 days, you can see the green graph is a consumption. It's an opening stock on day-to-day basis, how it's changing. The red color graph is a consumption, and the blue color graph is purchase. So what it tells you is that on day-to-day basis, based on consumption and based on purchase, how your opening stock is moving. And what it tells you is that as relative to the opening stock, how your consumption is happening. You can check only consumption and purchase comparison. And if you would like to say overall stock analysis, you can see that also. For example, say let's take again for this week consumption. You can see that on this one particular day, the red color is consumption is pretty low, but you have purchased a lot of stock, which is mentioned in terms of blue color graph. And that's why the opening stock has increased a lot, which is in green color. This tells you as compared to red color, which is consumption, how your opening stock is moving, which tells you that how much efficiently capital has been allocated. Again, this is a 7 days data, but over the year, over the months, if you compare the analysis, then it will give you a real understanding of how things are moving in the system. Now we have an audit management system. As we explained that in consumption analytics, you will be able to understand how much money was adjusted in audit. The audit management is a very crucial process, and it's done monthly or weekly basis in the diagnostic business labs. Now the biggest problem here is that how is the currently process done? What you do is that you print 100, 200 current stocks in Excel format. Then you go to the current stock and you mention actual physical stock against those 200 rows. Then you come back to the software and make manual entries in the system. So this is a very cumbersome process, and there are a lot of mistakes that can happen, and this is not an efficient way of managing it. So what we have done is that we have provided audit management system where you can create different audits. There will be option to schedule the audits in future. But at this point, you can create the audits, you can name the audit, and you can assign audit to the respective people. What it does is that it provides you a monthly and weekly audit management. You can easily manage it. Now, we don't stop on the web application itself. We have a mobile application, as you can see here. Now here you can see that this is under app. You have a current store stock. You can select pathology stock. Then there's a radiology stock, how much stock is available. You can manually consume the stock. You can see lot wise how much stock is available. Then you can scan the product based on HSN code and catalog code and then consume the stock. As you've seen that there's an audit, different types of audits. So every time you don't have to print Excel and then go and consider a physical stock in the system. For example, say you click on this one particular audit, you go on inventory details, you put on add inventory and you say that, okay, HIV kit, this is HIV kit. Currently, you can see that there are 2 bottles available and you just have to add a physical stock here, save here. And once you have saved all the stock in the system, then you just have to run submit audit and the stock will get automatically consumed from the backend based on the difference between physical stock and actual stock. And we'll show you based on the consumption and based on the prices that you have purchased, how much adjustment was done. And if you remember, we just showed the same consumption analytics under consumption analytics feature, where in pink color, you could see that audit management adjustments, right? Right here, we just saw that consumption analytics, how much was consumption done. And you can see that once you submit the audit and all audits in last 30 days, this audit adjustments will be shown in the system. Now, as we have come to the app, in addition to this, we have a multi-layer approval system. You can see that there are placing order approvals, receive order approvals. There are L1, L2, L3 different kinds of approval, which easily can be managed from mobile app itself. In addition to this, you'll get different kinds of alert notifications, below alert level quantity notifications, near expiry notification, expiry management, etc. Now, last but not least is that how the stock is moving in your system. So for example, say I would like to understand for dengue kit, how the stock is moving in the system based for the last 10 orders. So this is a weighted average that we have done. So for example, say how do you read this? Well, let's take an example of dengue kit. This is a red color is the time between PO to GRN. So it takes around 6 days for stock, the time you have placed order for dengue kit and for GRN to be generated in the system. Around 2.17 days, the stock is stayed in your main store. And then when stock is transferred to the department, it takes around 4.36 days for stock to get consumed. So on average, based on the last 10 records that have been done analysis, you can see that it takes 12.609 days for dengue kit to get purchased till it gets consumed in the system. Now what it does is that it tells you that how stock is moving, and if the stock is staying a lot of time in your main store, a lot of time in your department, then there's a lot of improvement that you can do in terms of optimization. And this information provides you exactly where is the place that you need to work on for this one particular inventory to make sure that the stock is moving faster rate in the system. Now we saw current stock management, different order management from department, from B2B partners, from centralized procurement from different locations, automated stock consumption, inventory consumption analytics, capital allocation, stock analysis, audit management, inventory time analysis feature, and we saw mobile app where you can manage consume stock manually, scan the barcode, and manage audits as well as approval systems. So this is an end-to-end inventory management systems which can solve all of your inventory management. And it doesn't just help you to record the system data, but also helps you to optimize the cost in terms of capital allocation, in terms of consumption, in terms of time and efficiency, etc. So this is an inventory software which can completely transform your inventory management. Either you are managing 1 lab or 10 labs or 100 labs with thousands of collection centers, you can seamlessly manage inventory with our web application as well as mobile app. Thank you for listening to us. We really appreciate this.
Nice presentation, Mr. Nikam, and a very nice usage of technology also. I'm now totally now out of time. We reviewed this session. It was a very nice, deliberated session. I must thank all the speakers here, Mr. Pankaj Johari, Director IPL, Dr. Atul Kochar, CEO of NH, Dr. Ravi Kaur, Principal Advisor in Spice Care, I can Sanchi Chawla, on the screen. Her presence tells me that I have to conclude now without speaking further.
Yeah. Thank you so much, everyone. Yeah. Thank you so much, everyone, for your thoughtful insights on decoding futuristic
In
diagnostic
this
sector.
diagnostic event, and we will discuss the future, and we discussed how technology can play a crucial role in transforming the diagnostic center. The need of the hour is to scale up the quality and take masses. Over to you, Kachi, for next course of deliberation.
Yes, sir. Thank you so much, everyone, for your thoughtful insights on decoding futuristic diagnostic sector. It was great listening to all of you. We would like to inform our esteemed gathering about our upcoming events, which are the fourth Farmer Leadership Summit on the 26th and 27th of April, the third Radiology and Imaging Summit on the 26th and 27th of May, and the Medical Education Summit on the 23rd and 24th of June 2022. We look forward for your future. I once again extend my warm gratitude to all our key speakers for their time and presence. Please accept a small token of gratitude from our end through these certificates that we present to Mr. Ravi Gaur for his insightful views. Thank you so much, sir. Mr. Prasad Nikam for his views on the topic. Thank you so much, sir. Dr. Atul Mohan Kochar for his insightful views, sir. Thank you so much. Mr. Abhimanyu Bhosle for sharing his views on the topic. Thank you, sir. And Mr. Pankaj Jori for his keen points. Thank you so much, sir. Thank you, gentlemen. It was wonderful listening to all of you. Thank you so much.
Thank you.
Thank you. Thank you.
Thank you.